This event really bridged interprofessional communication. I learned from watching EMS assessment and their approach to the situation. And communication is key. Simulated events included a trauma assessment, an EMS handoff of care to PAs at the patient bedside, and watching a video created by GFAC and Westchester faculty highlighting a patient scenario with a bad outcome. Then we had a facilitated discussion with participants to understand what could have been done better. In conclusion, the funds provided to our simulation from the Westchester University College of Health Sciences Community Engagement Grant were able to not only foster our relationship with GFAC, but help strengthen the need for and importance of interprofessional education and communication.
Since the inception of Mindful Painting at the Center for Contemplative Studies in the spring of 2023, over 180 WCU students, faculty, and staff have had the pleasure of partaking in the painting activities. This grant allowed me to engage the community by bringing in our first pop-up artist, Alexis Bocelli, a WCU alumna from the art department, and Alexis walked us through how to paint a serene landscape. This grant allowed me to bring in a second community artist, a WCU alumna as well, Rachel Siebalist, and she walked us through mark making with untraditional items such as forks and utensils and yogurt cups, and a great time was had by everyone.
We provided an overview of the social determinants of health framework to 32 staff members. Then we provided 2 member vignettes, followed by this question. If we knew more about this person's situation, how could we have served them better? This session was highly interactive, and staff exclaimed how much they enjoyed this training opportunity. In the feedback form, one participant wrote, "This will help me serve as a more impactful leader to deliver our mission in support of our community."
So at the end of the 4 weeks, we surveyed participants, and we found that 50% ate more protein at breakfast as a result of our program. 78% of participants said they would eat more protein throughout the day as a result of the program. And 43% of participants said they tried some of the recipes we introduced. And they noted they tried the tofu scramble at home, also the Greek yogurt parfait, as well as the energy balls.
Students returned with enhanced appreciation and understanding of knowledge and skills required to effectively serve the needs of bilingual, bicultural clients.
They understood the specific needs of their clients and the importance of involving their families in management of various conditions. The collaboration between our students and USP students benefited the clients by bringing the practices from 2 different disciplinary cultures to provide the best care.
My research project is assessing patient satisfaction with the quality of care that is provided under the National Health Insurance Scheme in Nigeria. I've been able to use these funds to recruit data collectors as well as a project consultant. This has been very helpful because I have been unable to travel to Nigeria to do the data collection myself. So I want to use this opportunity to thank the Dean and everybody in the Dean's office.
This study is exploratory, and the focus is on international medical graduates who are continuing their training in the United States as interns and residents, essentially through qualitative interviews and focus groups with the interns and residents and with graduate medical education directors. We want to identify gaps in their knowledge about the U.S. healthcare system.
And today we would like to profess our profound gratitude to the College of Health Sciences for the Faculty Student Research Award to carry out our project, Rallying WCU Rams, a unique way to interact with food labels. With this grant, a 2-session study was conducted over a course of 2 weeks to guide college students to make healthful food and beverage choices and help provide an easy path for them to compare products through the utilization of a food label reading tool based on percent daily values. We were also able to present this information to nutrition professionals at the Pennsylvania Academy of Nutrition and Dietetics annual meeting and exhibition, as well as at the Delaware Academy of Nutrition and Dietetics annual conference. With the generous help of this grant, We were able to purchase the necessary printed materials for both the study and the conference presentations.
What we're doing is to look at the quality of meals that are donated to the Safe Harbor shelter that's located in the borough of Westchester. And you can see that Safe Harbor is a nonprofit who work with homeless people and offer housing and meals and essential services to help individuals transition out of homelessness.
Overview of this project. First, the purpose here was to use simulation mannequins to teach safe and effective reduction of joint dislocations. So we were able to purchase these joint dislocation simulator models that you see pictured here, specifically the finger model, which demonstrates dislocation of the proximal interphalangeal joint of the middle finger. We're also using a shoulder dislocation model that was purchased last year in our research that we're conducting. The participants for this project will be athletic training students and physician assistant students. And the outcomes that we're going to measure include confidence, perceived competence, and actual observed competence in joint reduction skills. So we'll have the students complete a lesson on reducing shoulder and finger dislocations, and then they will demonstrate those skills.